Namaste, I am Dr. Vijay Warad from Pune. I am pediatrician as well as I am an allergist and immunologist. Since last 27 years I am practicing in allergy immunology. I have done the courses from American Academy of Allergy Immunology. Recently from the Munster University Hospital completed a master class in allergy and immunotherapy. I am the faculty in Indian Academy of Pediatrics in childhood asthma since 1996 and since 2011 as a founder member of Allergy and Applied Immunology chapter. I am the member of Indian College of Allergy Immunology Asthma, World Allergy Organization as a member, as well as I am the expert on the respiratory allergies by the European Academy of Respiratory Allergy chapter. See, now the season of allergy is happening all over India. We are getting a lot of patients, repeated cold, cough, asthma, sinusitis, ocular allergies because of the October heat. See, if you see worldwide, even 2019 now, World Allergy Organization, they have said it's an epidemic and there are now novel approaches for this epidemic to manage. See, even 20 to 30% of the population in India, in 2013 there was a study, around 400 million people had allergies, some or the other allergies, which are not being tackled from the root of cause. So if you see, even latest in Ganesh Chaturthi, there was news in Times of India. Cancer is not a big killer, rather than COPD is one of the second chronic disease. In 2017 new data is there, where the maximum deaths after the heart disease because of the COPD. And we are the topmost amongst the world because of the COPD. See, as practitioners, you must be getting such type of infantile eczema or gastrointestinal disturbances, polycyspasms in the children, or children with cough, cold repeatedly, or eye allergies, or eversion of teeth, or even the nasal terminates hypertrophy. This child, like which had been to me for the refractory ocular allergy, was not responding to any of the medicines from best of the doctors. And the history was that initially he had like a vomiting and he was told, जो बच्चों को उल्टियाँ होती रहती है वो चलता ही रहता है. So he was treated that way symptomatically. Later on, then he started having cough, cold, respiratory infections. He was treated for that. Then he had asthma. Then he was put on inhalers and all. And now he is having such a significant eye allergy, which is not responding to any of the medicines. His quality of life has been affected so badly. He misses the schools. He has to put a lot of eye drops. He continually scratches it. His cornea has also been damaged because of that. So this is a very common scenario. And if you see this, another child which had a significant ocular allergy, and another child which has had a oral mouth ulcers which are not responding to anybody. If you see carefully, his nasal terminate hypertrophy is there. This child was guided for the tonsillar aneurysm, but with the proper allergy management, he had a very good recovery. He used to have rhinitis and all. One more child which had a significant, after some medicines for the cough cold, used to have eruptions. This child with a repeated skin allergies, but clinically, carefully examined, his terminate were hypertrophied. This child was referred from the ICU from one of the best hospitals. Had a repeated cough cold initially, he was treated symptomatically. One fine day, he was given something and he had a significant choking up of the respiratory tract and he was rushed to the hospital. He was admitted for a few days for the coma. He is now having a mental retardation, repeated cough cold is persistent. Then we examined, when we did the testing, he had a significant dust mites which are common in the beds, in the sofas, curtains, everywhere. He was allergic to that. And if you see this picture carefully, the nasal terminates up to the sinuses, up to the ears, up to the lower airways, it's all connected with mucosa. This same child, which was not being treated properly and had a significant infected eczema, these long eyelashes, this eczema of the eyes, the dark circles, or the bluish back discoloration because of the edematous mucous membranes in the nasal and paranasal cavities. This molar spasm, like this lower eyelid spasms can be there, watering of eyes, nasolacrimal duct blockage, because the turbinates and the sinus pressure on the, then open mouth breathing, or some of the children they go on doing this way, allergic salutes. These are the common features, like some children they put into the nose. This is to relieve the blockers nose. And if you see the turbinates, it's a very simple test, just lift it and see. The inferior turbinates are the main antennas, and that's why all the dusts and pollens they get stuck up over here and the patient is getting sensitized. Sometimes in between the patient can be asymptomatic, doesn't mean that he doesn't have a sensitization which is happening inside or inflammation. It can be in the sinuses anywhere. Later on he will have a severe symptoms. So we have to always check for clinically. Some people have a Darius line, which is the bony and cartilaginous septum, horizontal line, that can be the sign of it. Some children they go, even adults also do such type of facial grimaces. Then inferior turbinate is very important. You have to always examine this very bad picture of ocular allergy. This child used to have repeated infections. Ask simply to say ah and put a spatula or tongue depression. Look for the posterior pharynx, where is the cobblestone appearance like artificial waterfall, how the posterior pharyngeal hyperplasia will be there. So it's a systemic disorder basically, and from one part to the another part, when the patient will have complications, you don't know that. So it's basically, some people initially have a colic spasms or food intolerance or acidity and all. Later on, rhinitis, or somebody has a rhinitis, they can have a GIT symptoms. Somebody has a sinusitis, they can have asthma or ear problems. It's all connected. It's a global problem, even leading to the skin problem. So why we should treat the children or any child or any adolescents or a young patient, adults, with a proper management? Because later on, the next generation, it is a very severe presentations with a severe anaphylaxis, asthma, COPD which is increasing very speedily. Inflammation is very important while treating these patients. So there are a lot of, in the worldwide, if you see, there are a lot of Zumabs which have been practiced. There are omalizumabs, mepolizumabs and all. Still in India, only omalizumab which is available. If you see these grass pollens, flower pollens, insects, droppings, feathers. Even last month only I was in Japan for the pigeon feather droppings in Pune. 37% had a problem because of that. Even the food allergies is increasing, anaphylaxis. Every week we are having 2 to 3 patients at the age of 65 or 25 or 8 years, they have a significant anaphylaxis. So if you see carefully, even the dusting, these particles, or suppose we do the carpeting, these dust mites cannot be seen, but you are exposed to that regularly. And then it causes a balance into the body. So the child increases the Th2 cells, which of allergy they increase. They suppress the Th1. That's why these people have a secondary infections. So we are treating the infections and with nebulization, bronchitis or rhinitis with the nasal sprays or nasal wash and all. But the underlying cause is remaining there. Suppose one person is having a problem, his children 85% chances are there with a severe allergies, his siblings also 85% chances are. So which patients to be treated in a root cause with the proper allergy management? See, there are a lot of advertisements in the newspapers and all, they are misguiding. Even some of the labs they come with the 900 rupees per allergen. But which test to be done or which patients? So repeated rhinitis, bronchitis or asthma or urticarias, angioedemas, skin allergies, eczemas, as well as those patients which have a significant food allergies. We should go for the, if you see the American Academy, Indian College of Allergy, European Academy, Global Initiative Against Asthma or Allergy, they have mentioned avoidance and immunotherapy has to be mentioned. Symptomatic management all are treating. Even in our hospital, we did around thousands of asthma patients data which are showing dust mites, pigeon feathers, animal danders, molds, indoor molds into the kitchen, the cars, the food particles they fall, and then they have a secondary fungus on that. Even in CIPP, in International Congress, we had a presentation on that. There are pollen calendars, specifically which season the pollens are sensitive. 200 times the pollen sensitivity has gone up. If you see the mild patients also, we should go for the allergy test rather than the severe ones. WHO, World Health Organization, has said allergy avoidance and immunotherapy are the only treatments they can stop the progress of the disease and future management rather than just symptomatic management. Even rather than using the steroids and antibiotics, we can use a very safe omalizumab type of molecules which are really useful to the patients. See, avoidance is must without any medicines also, because like a diabetes, how we always guide the patients for the sugar management, to do some diet management and exercise. The same way, avoidance has to be along with your prescription. After that, then whichever patient if you require desensitization or allergy vaccines, those immunotherapy can stop the newer sensitivities as well as the further progress of the disease from one part to another part of the body. In between, the patient can be asymptomatic. Suppose like previously we used to see childhood asthma is overcome up to 6 to 8 years or 15 years. But now it has been found the symptoms are overcome, the disease progresses. Later on, many children go into deviated nasal septum, sinusitis, ocular allergies, ear problems. 30% deafness is because of the allergic rhinitis. So even 2017 Indian College Allergy Guidelines, I was one of the faculty for that. 3 days in Bangalore, we had 65 countries allergy specialists were together, and allergy avoidance with a specific allergy practitioner who can take a detailed history for that patient's lifestyle from the family history. Selection of allergens is very important rather than panels of tests from the laboratories. And then after selecting the allergens, whichever the comes report, some of them which require immunotherapy, they can have a cross reactivity and cross immunity to the other allergens also. So they may not require all the panels should not be tested, and all the immunotherapy for all the positivity should not be there. Even the cost effectiveness, if you see, the patient which take the repeated medicines and later on they go into the complications and their cost also increases. Rather than that, you treat symptomatically and immunotherapy, the complication also stops and their cost also comes down that way.